Hi, this is Dr. Stone-Gale, and I'm just going to go over the written prescription portion of your SOAP Note Challenge assignment because this is inclusive as part of that three-step assignment. So you may have the opportunity to write one prescription, two prescriptions, or three prescriptions. It's just really going to depend on what diagnosis that your patient has during the SOAP Note Challenge. So if you're writing a medication prescription, you want to choose a medication of your choice that is related to the symptom or diagnosis. So whatever it is that you would need to use to treat that patient. On that prescription, you want to make sure that you have the patient's name and address and date of birth and the date of the prescription. Now, if you are writing for a controlled substance, you do need to remember that federal law says that you do need to write out the name of the month. So you can't just put 7 for July, you would need to put July. Also, if it does require a DEA number, then make sure that you just make that number up. And if there's any refills needed, and then sign with a fake name, not your own name. Your prescription should include the dose of the medication, the frequency of the medication, the type of the medication. So are you giving a tablet? Are you giving drops? Are you giving patches? And how is it being taken? What route are you going to be giving it? Are you giving it PO? Are you giving it sublingual? Are you giving it in the eye? And then the number to be dispensed. This should go below your directions to the patient or the SIG and not in the middle of or above your medication. So some of the frequent errors that students make is they forget to put the route on. This is notorious. So watch that you're putting the route on, and don't forget to put how many you're giving per dose. So if you write a prescription for singular 10 milligram tablet daily, the pharmacist does not know how many tablets daily you're giving. Now, he does know that it's only given once a day, but he is not allowed to fill it unless he has an accurate prescription. So you need to write singular 10 milligrams, 1 tablet PO daily at HS. If you write singular 10 milligram tablet daily, they'll probably kick the prescription back. So these are some common errors that students have a tendency to make on this assignment. Using medical terms is really important when you're writing prescriptions, not only for accuracy, but for professionalism. So if you're writing 4 drops, you would use the 1 and a V with the drops. If you're using medical symbols for 1, or you can write it out as the 1, but you don't want to just put 1. The problem is it's mistaken for a 7 when you write it just as a 1. And then these are some symbols for 1, 2, 3, and 4, and you can have a look at this link here where there's some abbreviations for this. And you do not need a diagnosis on your medication prescriptions. You may also be considering writing a diagnostic test or a laboratory test prescription. You may write both. It just depends. If you have a patient that you're looking for a CAT scan of the kidneys and a urinalysis and CBC, you may need to write those, but those would be separate prescriptions. Your diagnostic tests and your laboratory tests go on separate prescriptions, because if you're giving these to a patient, they're going to be going somewhere to a diagnostic center, or they could be going to a lab. So they're not going to be going to the same place. So choose a test of your choice that's related to the symptoms or the diagnosis for the SOAP Note Challenge that you come up with. And then make sure to look at the treatment guidelines and write it according to those treatment guidelines. And remember the same thing as the prescription. You need the patient's name, their address, their date of birth, the date of the prescription, and then the specific test as well as the diagnosis must be on there. Now, you don't put the diagnosis on the medication one, but you do put the diagnosis on the lab one and the diagnostic test. Because if you don't have that on there, then the insurance company has no idea what to bill, or the lab or the diagnostic company does not have any idea what to bill your insurance company. And then make sure to sign this with a fake name, not your own. So on this prescription, you're going to have the type of the test, the patient's diagnosis or their symptoms. And some common errors that are made is do not write the diagnosis next to the test. like for MRI of brain for headache or due to headache is a no-no. You want to write MRI of brain, DX is headache. For TSH for a thyroid problem, you would write TSH, diagnosis hypothyroid or fatigue or something like that. So you're using symptoms. If the patient's already been diagnosed with hypothyroidism and you're running a TSH, you can use hypothyroidism. But if they're coming into you with complaints of fatigue and they've never had that diagnosis of hypothyroidism, then your diagnosis would be fatigue. So you must have a diagnosis that correlates with the test for insurance billing purposes. If you don't, they won't be able to run the test. And do not put refills on this prescription, only medications. For some reason, students circle no refills on a lab test and a diagnostic test, and that is not correct. So please do not do that. The other prescription could be a specialist referral. Now, in primary care, most of the time, the referral department is doing this for you, but there are times when you might want to send a personalized note to the physician and hand it to the patient to give to them. And you only really need to put the reason the patient's being referred, but you want to also maybe write a little note to them, like what I've written here. Dr. Lewis, please evaluate for a new onset of elevated renal function and a decreased GFR. This patient has diabetes and hypertension. Thank you. And sometimes, I'll send someone to GI, Dr. Soft, can you please evaluate this patient for elevated liver function tests and for fatty liver on CAT scan. And that's all you need to really put on there. But always put the word thank you there. And that's about it. If you have any other questions about anything, please contact myself or your course faculty, Dr. Gardner.